Good morning, everyone. From today, we will start with new repertory, new topic, that is computer repertories. In computer repertories, many repertories are important, and there is many times long question on these computer repertories, as well as there is short note, short for 10 mark question is also asked in previous university examinations. There is long question on computer repertories, especially radar, then compact, Kara. So these are the repertories on which the questions, short notes that are asked in previous examinations. So what is computer repertory? What is first computer? Computer is nothing but an instrument which is used for computing, for collecting the information. So which is called as computer. It is nothing but an electronic device in which we can store, restore, it process the information or data and help us to solve our problems quickly, easily, and give us a meaningful result in short period with less efforts. So the computer, it plays a very important role as well in homeopathic repertories. In homeopathy, because with the help of computer we can easily, we all know that with less efforts, within short period or short time, we can able to find out the exact simillimum, because the proper repertorization process is to uh, it is time consuming, as well as it require much efforts to do proper repertorization. But with a help of this electronic device, with help of this computer, we can within a short period quickly, with less efforts, we can able to find out the simillimum. So in our homeopathy also, these repertories which are the softwares which we use through computer, they are very much useful in homeopathic practice also. Then the many times, as there are advantages, there are disadvantages, and many people, they criticize anything which came in market. So the general criticism about these repertories is that they take away valuable time of the busy practitioner, which has been nullified with advent of this repertory. So not about computer repertory, but in general, there is many criticism. Many homeopaths, they do not repertorize properly, because the proper repertorization, it is a time consuming process, and so directly they choose or they select with the help of only 1-2 symptoms, they go for selection of the remedy, and they prescribe the remedy with only 1-2 symptoms. But it is the total wrong way of prescribing homeopathic medicine. And with the help of computer repertory, this time we can able to save with the help of these computer repertories. So the time, valuable time, it was get nullified with the which is the most important advantage of this these computer repertories or this electronic device. These computer repertories, they make a drastic change in homeopathic repertory, because in one software we get much information, we get more repertories in one software, we get more materia medicas in one software. So we get uh, much information in one software, in one package. So they are helpful to refer, these softwares are helpful to refer the different materia medicas, they are helpful to refer the different repertories at the same time for the same case. And this technology, uh, which is having the collection, as well as it is having a collection of information which is available from various sources, from different parts of the world, as well as from different authors, from different in these softwares we get the different materia medicas as well as different repertories. So they are very much helpful to find out the, or to refer the other materia medica, the other repertory at the same time while repertorizing with one repertory. And due to all repertories, all most repertories, number of repertories and number of materia medicas, they are included in one software. So it is also cost effective, as well as we can easily carry the it from one place to another place as compared to books. And so these softwares are very much helpful. Then today about there are large number of materia medicas, large number of remedies in our materia medica, and many materia medicas are there of different homeopaths. Then there are many repertories which are also written by different homeopaths. So it was difficult to refer all the materia medicas, or difficult to have, it was hardly possible to have every homeopath these all repertories, or most of the important repertories, as well as materia medicas, but with these softwares it was possible. The Kent repertory, it is having, or it is considered as a standard and authoritative source book, which contain about or more than 45,000 symptoms, and it is having many sections, different sections. So in many softwares the Kent repertory was included. And while if we go through, or if we take any case, when we approach any new case, when any new patient came to our clinic, then history taking, case taking, proper case taking, then proper repertorization, it was, it required too much time, as well as it required extensive manual work. It require about 2 to 3 hours for each case, and it was difficult to remember each symptom and rubric with the manual process of each patient. When we are doing our homeopathic practice, then each symptom, it was difficult to remember each symptom and each rubric in each repertory. There is arrangement of repertories is also different, as well as it was difficult to remember every symptom of every patient. So at that time also these repertories are helpful. Nowadays computers are used. It is a part of life, and for homeopathy also it is, there is no exception, because it is very useful in homeopathy also, and it is a technological wonder which have equivalent to hundreds of electronic components in the silicon chip which is there in that computer system, and which is very small in size, but then also it save all the information. These softwares, the homeopathic softwares, it can be developed in any program language, and in 1974-75 there was a revolution in computer therapeutics. Then since 1980, about 1980, Homepath, Kentopath, then Polycresta, Radar, they have came to the market. So one by one, many repertories, many softwares, including different repertories and different materia medicas, they came to market. In the computer, there are different steps, that is inputting, storing, processing, outputting and controlling. And we discuss in detail about the advantages of these computer repertories. So evolution of these computer repertories. For getting simillimum, many people started searching for quick technique. Several people developed cards, but because of limitations, card technique was remained behind. The first program was called as Lamina, which was developed in Australia. This work was based on Kent's repertory. So, first work in computer softwares in homeopathy, the first program was Lamina, and this all it is based on the Kent repertory. Then there are many advantages of this computer repertory. It is useful like a library, because there are many materia medicas and repertories as we discussed. It contains all the information except introduction and general comments about the drug. There is an easy and useful bookmark system. That means you can track and go back to any text by placing a marker on the page in the Materia Medica window. So, to go back to the Materia Medica window in these softwares, there is a bookmark system, as we make the bookmark while reading the book, in the same way there is one bookmark system so that we can easily track or go back to any text by placing a marker on the page in the Materia Medica window. In these softwares, it also includes philosophy containing Kahneman's organon, Durkheim's philosophy, Robert's philosophy, etc. So, with not only the Materia Medicas and repertories are included, but with these repertories and Materia Medicas, the philosophy, the part of organon of medicine, which was given by Dr. Hahnemann, it was also included in these software so that we can easily get the reference of organon or philosophy while finding out or while selecting the simile. Then find rare symptoms in difficult cases. One can scan the entire literature for occurrence of any rare symptom in the text, which is usually not listed in the repertory. Many times the rare symptoms which we found during drug proving, they are not mentioned in the repertory or they are not listed in the repertory. Such rare symptom we can get in these softwares. Useful to find more complete rubrics. Find out the complete rubric. What is complete rubric? Means the rubric which is having its location, sensation, modality and concomitant. We get the complete symptom. So to find out more complete rubrics, these softwares are useful. Then to find out the proper words as well as books, it is these softwares are useful for selective search for words and books. Useful to analyze the case, to group the symptoms according to the philosophy of the repertory which we are going to use for repertorization. Then useful to make your own materia medica for clinical uses. You can able to make your own materia medica according to your clinical knowledge, according to your clinical experience. You can able to make your own materia medica, which is again useful in clinic during practice. Then in these softwares we can make own additions, and as these repertories are giving the quick result, means there we can able to find out the symptom very fastly, very quickly. They are also useful for synthesis of rubric, to make the form or to make the rubric. Then though the data of the case information which we get from the patient, though it is large, then also it gives the result in short time and accurate, because it was processing continuously. Then it is used in specialized functions like a detailed systemic case history, storage of patient history, like basic information for research purpose. When we are taking the history of the patient on paper, then it is the the storage is quite difficult after some days, and to find out the previous paper, it was also the physicians are also facing some difficulties. But in these softwares, we can easily find out the patient's history, basic information for research purpose. These repertories are useful for repertorization and get cross references and meanings. In these softwares, we get the cross references as well as meanings. And all we know that it is time saving as well as to study materia medica and repertory. It is very much useful. So these are the main advantages. It can handle a large amount of data. It is speedy. It gives accurate result. Then it can perform continuous processing. We can find any symptom in any repertory or materia medica. A finely tuned repertorization can be done. It helps in comparative study of medicine. Then patients' files and cases can be studied much faster, as well as we can get the previous data of the patient very easily, as well as it is we can store the data or information of each patient very easily. So these are all advantages of computer repertories. It is highly sophisticated time-saving method. It saves laborious work of writing rubrics. As soon as information is fed, it is displayed on the screen. It has the capacity to store vast information. So this is all about the advantages of these computer repertories. Then there are some disadvantages also. The disadvantage is that most of the software is very expensive. All we know, these softwares are costly, they are expensive, and so a common man cannot afford to buy it. We found extreme mechanical dependence when we are using these, when we get habit to use these computer repertories, then we get dependent on this mechanical device, this electronic device, and there is extreme mechanical dependence. can it may go wrong. It can go wrong very often. A doctor habituated with computer will be computer dependent. He cannot easily use the repertories or proper, he cannot do the proper repertorization. If the computer goes wrong or the power supply is cut off, the doctor will not able to prescribe any medicine on his own, because he get or he became totally dependent on the computer, and so it was difficult to prescribe the practitioner without this software, without the help of software. Without the concept of manual operation is difficult. Gaining knowledge is less when we use the computer frequently. So when we use the computer frequently, then we cannot think much, we cannot try to gain the new information. So automatically our knowledge gain became less when we use these mechanical device or these computer softwares. There are many Indian softwares as well as foreign softwares. The Indian softwares are Homepath, then Polycresta, Organon, Kentopath. So these are the Indian softwares. Once I will repeat. There are Indian as well as foreign software in the repertory. So the Indian softwares are Homepath, Polycresta, Organon and Kentopath. And the foreign softwares are Radar, Cara and Similia, then Cara Lite, HRS means Homeo Repertory System. And what is the long form of radar? That is Rapid Aid to Drug Aimed Research, RADAR. Rapid Aid to Drug Aimed Research. So, in the foreign softwares, the radar, Cara, Cara Lite, Homeo Repertory System, then Mac Repertory, Homorep, Homoyorep, then Lamina, Micropath, the Samuel, the Profile, Medical Expert System. So these are all foreign softwares. Out of that, we learn one by one the important softwares. So in this way, these softwares or these computer devices, they are again divided into two categories, that is Indian and foreign softwares or Indian or foreign computer repertories. The computer cannot act on its own. We all know it only carries out the instruction given truthfully and the sequence given. This sequence of instruction given to computer is called as a program, and the language understood by computer is called as machine language. Some languages are which are commonly used are Fortran, that is formula translator, COBOL, that is common business oriented language, then BASIC, that is beginners all purpose symbolic introduction code, and Pascal, that is which was named after the French philosopher. So what is role of homeopathy, role of computer in homeopathy? So Dr. Dikshit was the author of Organon 96. He explained what is the role of computers in homeopathy. And they give the following, or they mention the following information, that is the computer information storage and retrieval. No homeopath can store the entire materia medica or the repertory in his mind and be able to recall it accurately at the desired moment. As I told, that no one can able to remember or remind all the data from all materia medicas as well as repertories. No homeopath can able to store, can able to remind all data from every medicine in our materia medica, so that only the repertory was born. And these programs, they have been constructed which carry out the required permutation and combination according to standard rules, as for example repertorization, and yield the results. Most of the programs available today fall into this category. Then expert systems. This is a program designed to act as an expert in the particular domain. It goes through the thinking process of experts in the field, breaking them down into suitable steps and then programming these steps into software. So these are nothing but they act like expert system, they act like expert, and we can easily reach towards the final result after the repertorization. So it is called as expert system. Then computer assisted instructions. They are these educational programs function as an individual tutor to fit the learning pattern of the individual student. These are the system with artificial intelligence. These are advanced systems which aim to do anything which man does with understanding and using common sense, which, as we know, a machine does not possess. It thus